Welcome to Science News. My name is Ralph Sacco, a past president of the American Heart Association, and here we are in Dallas, Sessions 2013. And I have the pleasure of being with one of the late-breaking principal investigators, and it happens to be a stroke trial that's being presented here in Dallas. So, to my left here is the principal investigator. Can you tell us a little bit about this trial and the importance for stroke?
Sure. China antihypertensive treatment trial in acute ischemic stroke was a single-blind, randomized, blind endpoint trial conducted among 4,071 patients with acute ischemic stroke with onset within 48 hours. All of the patients have higher blood pressure, which means systolic blood pressure between 140 to 220. We randomized assigned study participants into antihypertensive treatment group and the control group. The antihypertensive treatment was designed to lower systolic blood pressure by 10 to 25% within the 24 hours and achieve systolic blood pressure lower than 140 and the diastolic blood pressure lower than 90 at 7 days or after 7 days during hospitalization.
So an important large trial, acute stroke, even though there are some strokes that are excluded. For example, if you had got thrombolysis, you were excluded from the trial. If you had very elevated blood pressure, you were excluded from the trial. But otherwise, the group that was randomized were, say, borderline blood pressures, and some were brought down to a certain level. And what was the level of blood pressure that you aimed for?
We aim to reduce systolic blood pressure by 10 to 25% by 24 hours, and the systolic blood pressure lower than 140 and the diastolic blood pressure lower than 90 by 7 days.
And the trial did show you can actually reduce blood pressure pretty acutely in the early phase of stroke, and you were, I think, quite good at getting the blood pressures down in that group. There were significant differences between blood pressure control in your one group versus the other. Tell us a little bit about the results in the different groups.
Really, by 24 hours, we were able to reduce 12.7% systolic blood pressure in the intervention group and about 7% in the control group. By 5 days, really, systolic pressure was lower than 140 for systolic and lower than 90 for diastolic blood pressure. However, we did not find significant difference in the primary outcome, which was death or major disability. So pretty much the primary outcome was 33.6% for both groups. They are identical. So we don't find any difference between the two groups regarding to death or major disability.
So in these two large groups, one group treated more aggressively to reduce blood pressure, the other group letting the blood pressure just ride without medicines, there was no difference in death or disability. And I assume it wasn't death that was the most frequent outcome, it's really disability after stroke. Is that correct?
Yes, it's correct. The major disability was defined as a modified rating score equal or larger than 3.
So, and you also looked at some secondary outcomes beyond that of hospitalization. Can you tell us a little bit about those results?
Yes. We did a follow-up examination at 3 months. We found the death rate, recurrent stroke, vascular disease, or combined outcome were not different between the intervention or control group.
There were a couple little shining stars, we'll say, on interactions. One was the group that was treated more than 24 hours compared to the early group, where there was a significant interaction in the 90-day outcome. Care to speculate on those results?
Yeah, we do find a significant reduction in the primary outcome among a subgroup. The Angeles trial after 24 hours onset. However, I will say, we cannot, based on the subgroup analysis results, to make a clinical decision regarding to treat the patients. However, this really provide a good hypothesis for a larger clinical trial, treat the patients after 24 hours. So we will follow up this idea.
So we know that actually Chinese patients have different strokes than United States or American patients. Can you tell us a little bit about the type of ischemic strokes that the Chinese patients had in this trial?
Yes, in this trial, about 78% patients were thrombotic stroke, and about 5% are embolic stroke, and about 90% are lacunar stroke.
So we know that in other studies too, Chinese Americans or Chinese sometimes have more intracranial atherosclerosis. And I know that sometimes in trials it's hard to break that apart, but we do get concerned that lowering blood pressure in people in the acute phase of stroke can sometimes make things worse. Do you have any thoughts about that concept?
Yes, we do exclude the patients with 75% block in their major artery. So of course, our study really show, lowering blood pressure did not reduce risk or increase risk.
Right.
So the physicians has to make their own personal judgment about, based on patients' individual situation, blood pressure should be lower or even increase.
What are your next steps? You're going to plan another big trial? What have you learned to take you forward with this idea?
Yes, just like we discussed, maybe one trial among patients with acute ischemic stroke after 24 hours, maybe a good idea to lower blood pressure among those patients, after 24 hours.
Great. So here we are at Sessions 2013, hearing about a large Chinese stroke trial where it's been found that lowering blood pressure acutely versus letting blood pressure just go by itself in the early phase really is no different. And I think we have some good ideas about moving forward in the future and what to do with blood pressure. Our current American Stroke Association, AHA guidelines still call for reducing blood pressure when it's markedly elevated or treating blood pressure when you're going to go to thrombolysis. There are still many evidence gaps. This trial may help us and more trials in the future. Thank you for tuning in to Science News in AHA Sessions 2013 from Dallas.